Oh, thank you. Welcome, welcome everyone. I can see the slides are coming up. Thank you so much. It is with a very warm heart and a lot of excitement that I welcome you all to the event From Theory to Practice, the Personalized Cancer Care Alliance Position Paper 2.0 launch. I'm Dani Mozzi. I'm the CEO of IAPO, the International Alliance of Patients Organizations, and I'll be today's moderator of this very exciting webinar. Yeah, the slides are back. Before we start, I have a very important announcement. Can you please go to slide 3, Rachel? Yes, today we have simultaneous interpretation into Arabic. Everyone, the majority of the speakers will be speaking English. So anyone who wants to follow the discussions in Arabic, please go to the channel, the translation channel on the Zoom at the bottom of the window. If you have any issues accessing this, don't hesitate to get in touch with us on the chat. And also, I'd love to invite you to put your names, organization name, and country on the chat so we know who has joined and we can keep the conversation going. On the chat, you can also put any questions or comments you may have. Next slide, please. So today is a milestone for the Personalized Cancer Care Alliance, which I'll be calling, as we do call it, the PCC Alliance. And it's a milestone for us because it's not only the launch of a position paper with powerful content, but it's also the launch of implementation of the work that we have been developing the past 3 years, where we are coming up with key recommendations for real world action. So it's a lot about how to bring the patient voice to policy and how to shape it with our lived experience. I'll briefly explain why and what we have been taking, what we have been doing the past three years, and I'll take you through the PCC Alliance journey with us. Next slide, please. We created the PCC Alliance in 2022, and it was very focused on three key points. We were seeing the rising of cancer burden across the Eastern Mediterranean region, and we know that this is not particularly from this region across the world. And also a lot of inequities in access and outcomes, and inequities really in regards to different countries, in regards to gender, age group, and so on. But also a big gap between policy and implementation. A lot of policies developed, commitments agreed, but implementation on the ground wasn't following. Based on this, next slide. Next slide, please, Rachel. Based on this, and within this context, the Personalized Cancer Care Alliance was created. And since 2022, it has served as a very dynamic platform, bringing together cancer patient organizations, carers, patient organizations across the WHO Eastern Mediterranean region, but also some countries from the region of the WHO related to Africa and Europe. And the main has always been the the same, to advance personalized cancer care that is equitable and participatory. And in 2023, we developed one year later after we created the PCC Alliance, we launched a position paper on personalized cancer care. And it was originally focused on the Eastern Mediterranean region. It was the very first of its kind, which spotlight to policymakers the issue of personalized cancer care, but also provided a comprehensive roadmap for patient organizations and civil society as a whole to advocate and lobby for personalized cancer care in their countries. So this paper, it set the theory, the baseline for discussions and development of personalized cancer care within health systems to ensure that they are predictive, preventative, participatory, personalized, and preemptive. These 5 Ps that you can see on the slide, these are the framework for the work of our PCC Alliance. We believe that the 5 Ps can improve patient health outcomes, patient experience. It can match patient preferences as well, but also they can support health systems to become effective, efficient, safe, accessible, whilst also delivering quality healthcare in a compassionate and humanistic way. Next slide, please. And so this is an overview of our journey since the PCC Alliance was launched, where you can see we held webinars, we created this position paper, we also held very high-level meetings on the sidelines of the WHO meetings. There was one in Geneva on the sidelines of the World Health Assembly. There was another side event on the sidelines of the Eastern Mediterranean Committee meeting of the WHO in Cairo. And based on all these learnings and this theory that we were putting together, this collaboration with different stakeholders, we believed that it was the time to think about how to apply this to real contexts. And so what and why we came up with these pilots, because more than ever we thought we had the framework to be able to support cancer patient organizations in these regions for them to do the work they were doing, but take it to another level. So I hope we'll come up with details about the specific pilots in Morocco, in the Gulf, but also the work of the gender working group and how everything came up together in a workshop that was delivered in Manila last year. But I hope this very brief overview of our PCC Alliance journey so far gives you clarity of what we have been doing, but also gives you an understanding of the relevance of having the launch of this position paper 2.0 today. And the position paper 2.0, I think what puts it aside and differentiates it from other work is that it recognizes that advocacy must move from theory to practice. And in this position paper 2.0, you see the outcomes, the results of these 3 initiatives that you hear more details about. the Morocco Initiative, the Gulf Confederation Countries Initiative, and the Gender Working Group. And these three initiatives, they mark a critical shift from conceptual advocacy to implementation-driven action. And what's most important, all of them were grounded in real-world evidence, in lived experience, and multi-stakeholder collaboration. Before we start the presentations about each one of these initiatives, I think it's key for us to take a moment to thank everyone who has been part of this journey with IAPL. It has been a very collaborative and co-created process so far, and it will always continue like this. And I couldn't start I have to start with the cancer patient organizations that have been working with us, not only in this new updated version of the position paper, but who have collaborated with all the pilots and the initiatives that we have developed. And of course, I had to share a special thank you to the co-hosts of the workshops that we held in Morocco, but also in the Gulf, focus on the countries from the Gulf Confederation country. So with regards to the workshop in Morocco, we co-hosted it with the Amal Association run by our dear Bahija Guimi. And if we did what we did there, it was because of her collaboration, cooperation, and all her efforts to make this happen. And for the GCC workshop, the one focused on Gulf countries, a huge thank you for Dr. Khaled Al-Saleh. He's the Secretary General of the Gulf Confederation for Cancer Control and Board Chair of the Society for Smoking and Cancer Prevention. You hear more about him from him today. And finally, a big thank you to our sponsor partners. We have specific sponsors for the workshops, and a huge thank you to MSD and Pfizer, but also for the position paper. MSD has been working with us. And now to other key people involved in this process, Dr. Lamia Mahmoud and Hiba Walsahali. We'll hear more from Hiba today from the WHO Eastern Mediterranean Office. They have been key collaborators in this project, in this initiative. And finally, last but not least, is Dr. Sosan and Dr. Noon from Align Efficient. If we did what we did and we are celebrating all of this today, it's because of the hard work of you both. So what's happening today? We'll have presentations of each one of these pilots that I referred to, the one from Morocco, the one from GCC, but also from the Gender Working Group. And then we'll have the presentation about the outcomes of what we are calling the Manila Workshop, which was a moment where we gathered representatives of these three initiatives together to think about what we can do as a group. And we will also hear from the WHO, Dr. Hiba from the WHO Eastern Mediterranean region, and also from industry who has supported us here, Claire Lebled, representing MSD. We also provide you the opportunity to ask questions, so please don't hesitate to put them on the chat, or when it's time for the Q&A, we'll also remind you to share more. Now moving to the Morocco chapter, the Morocco pilot, which has been our very first pilot of the PCC Alliance to advance personalized cancer care on the ground at country level in Morocco. So we held in 2024, January 2024, a workshop co-hosted with Amal Association, who I just mentioned, run by Bahija Guimi, where we gathered 18 cancer patient advocates from Morocco. The workshop was completely tailored to the participants' needs because we held a survey in advance. We craft the content of the workshop based on the results of this survey, and the sessions and all the peer exchange opportunities during the workshop. They were focused on goal setting, stakeholder engagement, and a lot of focus on effective communication as well. And to talk about this specific pilot, I would love to invite Hajar Gader. She's the advocacy strategy lead from NABD BC2 Association in Morocco. She will be speaking on behalf of the group and sharing the story of her organization in this journey and the initiative as a whole. Over to you, Hajar.
Hello, everyone. Thank you, Danny, for the introduction. It is a pleasure being amongst you, and I'm very happy that we're finally launching the position paper too. It has been an incredible journey. So for the national pilot, Morocco was selected as the Group B pilot country, representing middle income settings with the objective of translating the 5Ps framework into concrete national level action. The process began with a structured pre-assessment, followed by a national capacity building workshop coordinated by Amal Association in Marrakesh in January 2024. This workshop brought together 12 patients' organizations from across the country, and it provided a valuable platform to introduce and explore the 5Ps framework, as well as to discuss how it could be integrated into advocacy strategies. It also created an opportunity to foster collaboration among patients' organizations and strengthen networks, particularly among those with no prior history of working together. So following the workshop, several patients' organizations initiated exchanges, including mutual visits and invitations to learn more about each other's advocacy work and activities. The workshop was also an opportunity to align the national advocacy priorities of Moroccan POs or patients' organizations. Next slide, please. Okay, it's already there. So what made this work? First, patient stories played a transformative role. Across Morocco, survival-led advocacy helped reduce stigma, encouraged early screening, and made cancer conversations more human and accessible. Second, grassroots mobilization, especially led by women, became a national force. Women who were once beneficiaries of support became advocates, then leaders and representatives at national, regional, and global levels. This shift is critical because it shows that advocacy is strongest when it is community rooted. A number of organizations took the lead on key initiatives. For example, NABD BC2 Association, for instance, coordinated with WHO EMRO to map cancer patients organization in preparation for a workshop co-organized by the Ministry of Health and Social Protection and WHO in November 2024. This workshop marked a significant milestone in Morocco as it introduced the WHO framework on meaningful engagements of people with lived experience and explored its adaptation to national priorities. It also brought together a wide range of stakeholders, including persons with lived experience of cancer, patients' organizations, academia, healthcare professionals, and representatives of governmental institutions. And this is where I would like to bring a reflection from the Manila workshop. As you see over there, we progressed from organization ready to speak to governments ready to listen. Another important initiative was led by Cancer We're All Concerned Association. They organized the communicative days in Tetuan in January 2025, following their strategic agenda. Now, the BCDU coordinated invitations to the Ministry of Health and Social Protection and WHO local office, both of which responded positively, and their participation added the value to the event and ultimately contributed to the establishment of the Moroccan Alliance of Cancer Patients Association, formally founded in February 2026. Next slide, please. So, what is the key insight from Morocco? We can say that advocacy works, but only under three conditions. First, when it is grounded in lived experience, patients are not just beneficiaries, they are experts in their own journeys. Second, continuous dialogue and structured follow-up. Patient organizations are no longer on the margins, they are becoming recognized partners in policy discussions. And third, when it is built on trust and cultural understanding. In Morocco, addressing stigma, language diversity, and social realities was essential to making advocacy effective. These three elements transformed advocacy from being symbolic to being impact-driven. And this is why Morocco today is not just a pilot, it is a replicable model for another Group B countries, seeking to strengthen patient engagement, building national advocacy structures, and embed personalized cancer care into their system. As highlighted in the position paper too, Morocco demonstrates that investing in patient leadership is not optional, it is strategic for achieving equitable and effective cancer care. Thank you.
Thank you so much, Hajar, for putting us up to speed with regards to the incredible journey of the Morocco group. Next slide, please, Rachel. It's very inspiring to see how much you have done in this past 2 years and how much you have amplified your collaborations and engagement across the country and beyond at a regional level and with different stakeholders. I would like to acknowledge these cancer patient organizations who contributed specifically to the Morocco chapter in the position paper 2.0. There are other organizations who attended the workshop and have been collaborating with us, but this is the list of patient organizations who contributed directly to the position paper. Now, moving to the next pilot that we ran this time, focus on the regional level. We are going to talk about the Gulf Cooperation Council, which I'll be referring as GCC here. And what happened is that based on the success of the Morocco pilot, but also our desire to adapt and expand these learnings to benefit a wider audience in the Eastern Mediterranean region, we decided to develop a second workshop, but this time at regional level for cancer patient organizations from 6 countries of the Gulf Confederation Council, but also a representative of the NCD Alliance of the Eastern Mediterranean region. And the countries who were part of this workshop were Kuwait, Saudi Arabia, UAE, United Arab Emirates, Qatar, Oman, and Bahrain. The workshop was held in November 2024 in Dubai, the UAE, and it was co-hosted with the Gulf Federation for Cancer Control, which is represented here by Dr. Khaled. And it was a whole new experience because this time we were looking at different countries with very different resources and challenges if we compare it to Morocco, but also different assets. And what was unique about this workshop as well is that we also had the participation of representatives of the WHO Eastern Mediterranean Regional Office, Hiba, who is here with us, and Dr. Lamia, which amplified the conversations to another key stakeholder group. So representing the GCC pilot, I would like to invite Dr. Khaled Al-Saleh And he's the Secretary General of the Gulf Federation for Cancer Control and board chair of the Society for Smoking and Cancer Prevention in Kuwait. Over to you, Dr. Khaled.
Thank you very much, Dani. Thank you very much. I'm very pleased to be with you and with other colleagues in different countries. Unfortunately, I was Dr. Hassa Shaheen. She used to be our participant in Manila. She couldn't attend that because of the delay of the airplane. But anyway, we are depending on what we are hearing in Dubai at the time, and we are trying in Kuwait and in our region to reduce the gap between theory and practice. And this is our job since that time on our meeting in Dubai. Also, I would like to thank all our administrative who are working hardly actually to
Dr. Khaled? I have the impression that Dr. Khaled was cut off. Can you confirm this, Rachel, please?
Yes, I can see that he was cut off, but I can see his colleague is requesting to speak on his behalf, so I'm just going to allow him.
Okay.
Sorry for that interruption in the internet, but can you hear me now?
Yes, we can hear you properly. Thank you.
Okay, that's great. I was to say that I would like to thank you and also Dr. Sausan Mali. She is actually a great job she did it in our Gulf area. Now I will ask Zakir to sharing my slide. Zakir, kindly. Okay, Zakir, next. This is the introduction. This is the why we are doing our effort to reduce, as I mentioned, the gap between theory and practice. And we are trying to identify our patient engagement, particularly in psychological and supporting digital advocacy. Next. Though we are starting our awareness campaign or awareness by focusing on psychological support, and we make it as a priority number one. And we are using a community as base to prevention and to using all the activity in our country to sharing with our awareness program, like sporting, rehabilitation program, training, and healthcare with healthcare provider. Okay, Zakir? The first active or first practice job we do that we called it a Makeen club. Makeen in Arabic mean that I can do, I will to do. And this is a club which have two aim in reality, that we are handling or convince patient who cured from cancer to be part of for this club, not to support psychology give them, not this is the main reason. The main reason to give him a chance to be a part of awareness program. We believe that the patient who are cured, they are more convinced to the society than others. Because of that, we've been joined those group and train them to be a part of awareness program. Till now, we have actually tens of participants. Those people or those previous patients is doing their good effort to give a train and giving a lecture and meeting either to the new patient or to the normal people to convince them for two issues. How important is to know what is the risk factor and to avoid it. Secondly, how important to know what is the early sign of cancer, because we know when the people or normal people be aware about early sign of cancer. That means that the journey from the disease to treatment will be short, and this is affects on the result of cure, and not only cure, or also a good quality of life. Next, Zakir. So we are in McKinney Club, focusing on psychological support, recreating trip by sport and art, and so on. Second, next, Zakir. So for McKinney Club, they are doing, as I mentioned, a hospital visit for the new patient to give him support. And also, as I mentioned, they are with society working for awareness and training, and also to survival empowerment. Yes, Zakir? So till now, we have plus than 6 physicians in the Gulf network of GCC, and we have 20 educated video produced through this group. This is McKinney Club, and active member open for all survival. Next, Zakir. Now we are addressing for volunteer pathway need to be aware, and our response actually is with partnership with our community leader, particularly Ministry of Health and Ministry of Affairs. Next, Zakir. So for the financial and deployment support for survival, this is a challenge actually. Many cancer survivors lost their job during their treatment and prolonged absence, and also because of that, we are having an fund, and this fund is giving a salary to those people who are lost their job during the diagnosis and the treatment, and after they cured, they are back to their job normally, or we can continue with them till they are getting support from other society. So also there is emergency financial grant for those people who are actually having a terminal or palliative work, and to help them to be back in home if they are not Kuwaiti, with a good amount of budget to make them living in their country with good integrity. Thank you very much. Next, Zakir. So McKinney Club is our goal is get survival back into the workshop, and also giving him training, particularly for computer skill, and give him a partnership with the job placement. Next, Zakir. So this is focusing area of our primary care and family doctor. We are focusing also, it's the second thing, that the training program, and in our advocacy here, in our helping our society here, we are noted that the cancer patient in Kuwait, there is about 50% of those patients who are presented late to the tertiary hospital. Because of that, we are starting this training program to make the doctors more skilled to diagnose the patient early, and to shorten the journey between the doctors or primary doctor to the tertiary hospital. Because of that, we are having a training for primary care, and we have having training on dentists. For the staff nurse, we are having this training to make this nursing staff a part of awareness program. We believe that the people in our community, they are believing those who are as either doctors or staff nurse. Because of that, it's very important to be sure that our dentists are ready to give right information about the cancer, particularly regarding a risk factor and early sign of the cancer. The number till now, I think 2,000 staff nurses have been, as you see here, a treating doctor. There is 1,800 primary care and family doctor being trained, and I think also for this is total training, dentist 1,700 case. For staff nurse, Zakir, for staff nurse till now is 3,000 staff nurse been training since we are starting 2016 till now 2025. Next, Zakir. So this is a picture of what's what. Now for palliative care, that establishment of the palliative care in Kuwait, this is our effort in our society. Actually, we noted that a lot of patients in terminal care, because we are sitting in general hospital or in cancer special care, they are not having the focusing from the treating doctors because there is no more active treatment for them. And most of them, they are occupying the bed without specialized care. Because of that, the society is starting their effort to build a hospital, a special hospital, which is having 95 beds to take care of this palliative and to creating this new terminology, this is 10 years ago, for palliative care. And we actually succeed in building this, and now it is working smoothly in Kuwait. Next, Zakir. So now this is what we called it a comprehensive palliative care, and it is working with multidisciplinary team approach, and it was also recognition by WHO. Next, Zakir. So palliative care in our philosophy should be started from day one of diagnosis. Next, Zakir. So, in summary, actually, in our training or on our effort to reduce the gap between the theoretical part of helping patient to make it a practice, we are creating this three effort. The first effort, McKean Club, is to have a patient who are being cured to share with us our effort in awareness and early detection. Second, those people who are having terminal, we are creating or building a hospital, specialized hospital for them to take care. The last thing is to be sure that the new diagnosis of our patient in Kuwait having at least journey from diagnosis to be treated by training the primary doctors and the dentist. Thank you very much.
Thank you very much, Dr. Khalid. It's very inspiring to see how much you have achieved, or all the work that you have been doing for the past years, but how much you advanced since we met in Dubai in 2024, and the idea of the McKean, which now it's achieving so much in regards to this holistic approach to cancer care, and the possibility of supporting cancer survivors and cancer patients in treatment. Incredible work. I would like to also acknowledge the names of the other patient organizations who were involved in the position paper 2.0 chapter specific focus on the GCC. You can read their names in this slide. And of course, there are other patient organizations who attended the workshop in 2024. So a huge thank you for your collaboration. We are now moving to the gender working group, which was also created in 2025. And it was a group with selected patient advocates who were invited to not only amplify the patient voice in gender issues related to cancer care, but also reflect about the barriers, the challenges in different countries in this Eastern Mediterranean region, and also understand what are existing practices that are achieving good outcomes and can be replicated and so on. So we put together a group of amazing advisors from different countries in the region, And today they are here represented by Dr. Rin Al Ajoui. She's the director of the Jordan Breast Cancer in Jordan, and she will be talking about the gender working group, uh, what was achieved, and the outcomes. Over to you, Dr. Ring.
Yeah, thank you very much, Danny, for this introduction. Good afternoon, everyone, and it's really a great pleasure to be with you all. I've been reading the names. All of you are dear colleagues and people we worked with, partners we worked with. So thank you, Ayapo, for always convening these platforms, and thanks to the entire members and group of the PCC Alliance. Today, I'm presenting the work of the Gender Working Group, or the Gender Chapter. If you can put the slides, please. Okay. So the work in general for the why the gender chapter, what it is, it's all about health equity. It's about how we can improve cancer care for women by making it more fair and more centered around patients, especially in our region, in the Middle East and Africa regions. Because as you know, even though there has been progress on ground, many women still face challenges that prevent them really from getting timely and quality care. Women are usually diagnosed at late stages. Women in our also region are diagnosed at earlier ages than what we see in Western countries. And this is really not because services don't exist, but because of other barriers that can be of social and economic nature, like stigma, cost, limited access to screening services, and usually because health systems are fragmented, and in many places there are no proper cancer registries and organized programs. So this is what our chapter is all about. Next, please. And you, as you can see from the photo, previous photo, surrounded with two powerful voices and powerful women, Claire and Hajar, who really contributed very well to the work in the gender working group and in the other working groups. Okay, next, please. Okay, so our approach, as Danny mentioned, we used the 5P framework, predicting risk early, preventing diseases from preventing cancer through screening, involving patients in decisions, and personalizing care, and acting early before disease progress. What we have learned, actually, we listened to real experiences. The lived experiences and people with lived experiences, patients, survivors, caregivers, really gave a different perspective to what we really usually think. By listening to women, we found major gaps, not only in medical care, but also in areas like fertility issues, mental health, survivorship and palliative care, and equity. So these are essential parts of care, but they are often missing. So having the patients in the center of what we did was really a game changer. Next, please. Okay, so the chapter called for action from everyone. Governments need better systems, better screening programs, and better data, particularly sex disaggregated data. NGOs and civil societies and patient advocates, we all should raise awareness and support patients and work in collaboration with governments. International partners should invest in equity more, and most importantly, women voices must be part of decision making. So it called for several recommendations. I advise everyone to read the chapter in details, but these are let's say the main recommendations: that we should be more holistic, we should work together, we should improve cancer care by multidisciplinary and multi-stakeholder collaboration. Next, please. Okay, so to summarize, let me summarize. In summary, improving cancer care is not only about advances and technologies and advances in treatment. It's really about equity, about dignity, about listening to patients, about putting women at the center of decision making. The chapter also, in this chapter, there was a south to south learning where we learned from the experience of Brazil. In Brazil, where they have their national cancer control plans and strategies, where they moved from fragmented care to making it more of rights-based approach, but also their civil society and their organizations, there are great voices. So there was this chance of learning and understanding what is happening across the world, not only in our region. And also here with also a photo of great colleagues, Dr. Hiba and Dr. Hissa. It was a pleasure to work with everyone. Again, thank you very much for the chance. Thank you, Danny. Thank you, Dr. Sausan, and thank you everyone attending today for listening.
Thank you so much, Dr. Reen, for sharing with us the learnings of this gender working group, and also joining my call to action at the end of this webinar to remind everyone to really read these chapters, because there are so many learnings that can be replicated in other countries, in other formats, and of course, acknowledge specific context. I just wanted to apologize for not sharing your full designation, Dr. Reen. So Dr. Reen is the director of the Jordan Breast Cancer Program at the King Hussein Cancer Foundation. Thank you so much, Dr. Reen. Always a pleasure to work with you. And in the next slide, you will see the list of other organizations who collaborated in this specific chapter. And as Dr. Reen mentioned, in addition to these organizations, we also had this collaboration with the Institute Side by Side from Brazil, who reflected upon this, the learnings of the gender working group. Now we are moving to a very important moment for the PCC Alliance, and I'll say for the IAPO journey as an organization, as an alliance, bringing together cancer patient organizations from all over the world, but in this specific initiative of the PCC Alliance, having patients representing having patient organizations representing patients with cancer. In November 2025, IAPO held its 11th Global Patients Congress in Manila, the Philippines. It was a 2-day congress where we decided to hold, on the sideline of this congress, on the 3rd day, we decided to hold what we are calling the Manila Workshop, which was an opportunity to bring together representatives of these 3 initiatives that you just learned about today to meet for the first time. They were coming from different countries and work together and share their, reflect together upon the outcomes of the initiatives, but also build relationships and think about collaborations. So it was, next slide, please, Rachel. So this was a very important moment where we again talked about how can we move from dialogue to action and what we can do as a group, and this time as a wider group. And also, which was unique, is that they had the opportunity to be part of a Global Patients Congress with patient organizations from all over the world, from other conditions, representing other disease areas, and how much these learnings could also be embedded in anything that was going to be planned at the Manila workshop. Next slide, please. In this workshop, which we'll hear a little bit more about in a second, we came up with a clear roadmap of what these cancer patient organizations believe should be actionable next steps for scaling personalized cancer care across the Eastern Mediterranean region. And presenting this roadmap, which has multi-level implementation, a multi-level implementation strategy. We'll have a video from Majed Mohammed. He's the head of community engagement and advocacy department from the Friends of Cancer Patients. Majed was part of the GCC workshop and also attended the Manila workshop. And he couldn't join us today, but he sent us a video to present the Manila roadmap. Rachel, can you kindly play the video?
Yes, I'll do that just now.
Thank you. Rachel, the audio is not coming up.
Say that again, Danny.
The audio.
Oh, okay. Just a
We
second.
couldn't hear Majed. Thank you.
Just a second, everyone. I'm trying to review this.
Thank you. And as Rachel puts up the video, always a good opportunity to remind you all to share any questions or put any comments on the chat. But also we have the Q&A feature available, so you can also put your questions there, and we'll try our best to answer them today. Any updates, Rachel?
Okay.
Sorry, Rachel, the audio is not coming up. Dr. Sawson, my dear, I think we might invite you to come up and support us here.
No problem, Danny. It's a pity because it was a powerful video for Majid.
Can
I have the slides, please?
Are we able to hear the audio, everyone?
Unfortunately not. We'll make sure that we share Majid's video with you all on our thank you email after this webinar. We'll put the link for his presentation, but also we'll put on our website. Rachel, can you please share the slides so Dr. Sawson can follow the slides?
Of course.
Thank you.
So the Manila meeting was really the culmination of the 3 working groups that was working on the pilot for Morocco, the GCC with the Gulf Federation for Cancer Control, and of course the gender working group. And at that event, we actually discussed the journey and we discussed what we were doing when it came to the position paper, but mostly is what we're going to do in the position paper later on. So from the Manila, and I believe everybody received the Manila report outcome. From the Manila report outcome, we had really 3 strong recommendations. And the priority goals that was highlighted by the Manila meeting was that we really need to put the lived experience wherever there is a policy dialogue. And this is, of course, aligned with, of course, WHO framework when it comes to the lived experience and including them in policymaking. The second recommendation was that we need to create a more stronger communication and network building among ourselves. So we have a really strong outcome that came from Morocco, and of course, out of that, now we have a big alliance for the patient organization in Morocco, which is a big, for me, it's, and I'm sure as well for Danny, it's a big, honor to maybe say that we contributed in that formation, but also it feels, I feel very much privileged and proud of what Morocco have done. And of course, we have the Gulf Federation for Cancer Control, who are already a good network among the Gulf countries. But further to that, I think more communication between the other countries needs to be established, and a stronger network as well building, which actually might be the new IAPO hub that is being developed, can be and can play that role. The also annual celebration of patient voices, I think that came very strongly in the Manila meeting. I just want to add that this year, Egypt, the Ministry of Health in Egypt have nominated 2000 or named 2026 as the year of the patient voice. They have now actually created something called the Patient Ambassador Program. And as far as I know, there is a big plan to create a high-level patient board, which I believe even the Minister of Health will be himself chairing that. So there is a momentum happening in the region, and I think, and of course, it's all thanks to the active voices of the patient voices, but also of the partnership, either from the industry or the WHO, who are actually also pushing that momentum. Next slide, please. I can't see the slide, but so the multi-level implementation module that the Manila Manila meeting wanted was, on the base, we will always have our community and our storytelling. But on a national level is to shift that storytelling to a more policy and Ministry of Health engagement. And on a regional level, we need to create those collaborative platforms to work together and share those experience. But also, we need to have also a presence and understand what is happening on an international WHO level when it comes to policy. And what is happening, what I used to see previously happening, is that we are working really well on a local level, on a community, on a local level. We're doing a really good job, but there is a big disconnect between what I'm doing on the local and what is the global is actually trying to achieve. And the global always is linked to the national, because WHO is actually paving the way for governments and Ministry of Health when it comes to how health policy should be adapted and implemented in each country. So what we're trying to do is we're trying to create those multi-level implementation. And for me as a patient advocate, and for all of us, it's not just thinking on a local, on a community, which is always going to be the core of what I'm doing, but also take it to how can I impact on a national, how can I impact on a regional, and of course taking to the global or international level as well, and bringing it back to the local community. Next slide, please. And of course, one of the key success factors that has to be is we have to work across stakeholders and across partnership, and especially with the public-private partnership. Now we see governments doing that. We need to put lived experience in the core, and I think this came strongly from the Manila meeting. Use existing platform. If you're going tomorrow to attend a meeting, to attend a conference, speak in on somebody's be invited as a speaker, use that to amplify the messaging, especially, and use whatever is there in the position paper, because there is wealth of knowledge. But also not just mention your success, also mention others, because I believe what is there in the position paper is a really good, strong benchmarking that I personally will use whenever I'm going to speak about how amazing and how effective patient advocacy has been developing in our region. And of course, use the multi-level action. And yes, we are focusing on on my community, on your community, but also take it to a more higher level, national, regional, and international, and bring the international and regional back to your community level. Next slide, please. Yeah, that's it. Thank you. Over to you, Danny.
Thank you
I'm
so
sure
much,
Mahmoud would
Dr.
have done a
Sousa.
better job, but
No, but thank you for stepping in. This just confirms the power of collaboration and how our alliance works, one holding each other's hand. Thank you so much for stepping in and sharing the results of this Manila workshop. But again, there is a report about this where you can see everything in detail, and you can also learn from the outcomes and see how you can apply in your own work. Now we're moving to another phase of presentations. I'll invite two key partners of ours in this journey, where they are going to share their views on the value of this work that we have been doing the past 3 years, but also the importance of multi-stakeholder collaboration, and more specifically, coming from their specific area of work. And first, I would like to invite Hiba Al-Sawali. She's a consultant at the World Health Organization Eastern Mediterranean Regional Office. And she has a very important role there because she has been supporting countries in the implementation of pilots of the framework on the meaningful engagement of people with lived experience in NCDs, mental health, and neurological conditions. And it's very inspiring to see the Eastern Mediterranean region in that position, leading that work, and of course collaborating with Hiba in the PCC Alliance. Over to you, Hiba.
Thank you so much, Danny, for the wonderful introduction and for inviting me. Thank you, Dr. Sausan, for not only being part of this webinar, but being a partner with you in the development of this work and leveraging synergies and the expertise of people with lived experience in the Eastern Mediterranean region. Today, I'm really inspired by the presentation from Hajar, from Dr. Khaled, Dr. Reem. I'm sure the video message of Majid was also powerful. So being part of this region makes me especially proud to see these voices amplified, moving from just storytelling, which is a very powerful tool, but to the implementation of meaningful lived experience driven interventions that reflect the real needs and aspirations of people with lived experience. The WHO framework on meaningful engagement of lived experience is a practical tool and principled roadmap to help us move from just consultation into co-production and shared decision-making and sustainable partnerships. Today, even like a small detail like bringing in Arabic translation to the audience from the region is very a powerful tool to make sure that we are inclusive as much as we can, because from experience, language do matter, and it tells us who can really participate and who can be around the table and who cannot. Across the EMR, we are seeing and encouraging momentum, honestly, from both the patient-led and caregiver-led organizations and also from ministries of health and officials. We are seeing lots of recognition of the importance of engaging people with lived experience, the value that they can bring to the table. And in our country, dialogues, we held multi-stakeholder dialogues in 5 countries in the region, ranging between high income, middle income countries, and even country in an emergency situation. We saw the potential and the role of people with lived experience, and people in the power and the decision-making position recognize the value of engaging with them, and between brackets, the value or the risk of not engaging with them as well, because they are no more like recipients of the care. They have lots of interventions that they can do at their community level and at the national levels as well. So these efforts are not just in vacuum. They go in line with what patient-led organizations and what IAPO is driving, and they are really connected to the global commitments, including the achievement of the SDG target 3.4 and the advancement of people-centered care within universal health coverage. So, on a personal note, and being from the region, I'm very inspired to see the voices of people from my region being amplified, and I'm very grateful for those who joined this webinar from all around the world, especially those who are still in the early morning. It's really good to join us and start your morning with this inspiration note. And I invite you all to carry this forward, not as a one-time conversation, but as a continued commitment to move from dialogue to partnerships and from representation to real influence. Thank you so much, and back to you, Danny.
Thank you, dear Hiba. Thank you for always inspiring with the work that you do in the Eastern Mediterranean region. We know how much WHO has been advancing in bringing people with lived experience to the work that you are doing, but also creating more strategic ways of engaging with patient organizations. So I look forward to continue working with you. Now I'd love to invite our dear Claire Lebled. She's from MSD, and she leads EMEA Regional Patient Engagement at MSD. And Claire, I would love for you to also share with us what is the value of collaborating and being part of an alliance as such, and seeing the engagement of people with lived experience and patient organizations in cancer care. Over to you.
Hello, everyone, and thank you so much, Dani, Rachel, and all partners for bringing us together for this important launch. I really appreciate this position paper 2.0, the shift it represents from ideas to implementation and from recommendation to real-world action. And I really would like to acknowledge and congratulate all involved in this amazing work on the different chapters. I was super inspired today by all the interventions. This Personalized Cancer Care Alliance work together also with what was just shared by Hiba, clearly explaining how meaningful engagement is now being operationalized within the WHO EMRO countries. So this creates both an opportunity and a responsibility for all of us, including industry, to align our action with this principle. So I'm here representing the industry perspective and also as someone who works every day on patient engagement. From our side, the most important starting point is simple. Patient lived experience is evidence, and health systems work better when that evidence is consistently included in decisions. So from my perspective, there are 3 practical areas where industry can contribute responsibly alongside partners. First, strengthening the ability of patient organizations to participate. not speaking for patient organization, but really supporting patient advocate and organization, supporting them to speak for themselves. So we are doing this through capacity building, providing practical tools to engage in policy processes. Second, it's about helping move dialogue into structured, repeatable practices. So, for example, supporting clear frameworks, consistent approaches, and practical how-to models that can be adapted by country. And third, convening and connecting with the right governance, of course. So industry can help convey multi-stakeholder dialogue and connect partners across the countries, as long as it's, of course, transparent, ethical, and really guided by patient priorities and public health goals. What I found powerful about the PCCA journey is that it has produced real implementation experience. So across the Morocco chapter, the GCC chapter, and the gender working group, it is now turning those learnings into a roadmap for action. MSD has been supporting this PCCA journey, and we really value how this alliance brings together patient organization and partners around a shared implementation agenda. So from MSD side, I see it as a long-term journey, not a one-off launch. At this point, the commitment I feel confident to state are the following. So we will stay engaged with the alliances and continue to show up as a constructive partner. We are already in discussion with country to understand how we can support taking this into practice and way that fit really local needs and governance. And personally, I will keep, of course, bringing this patient engagement lens into our regional conversation to help ensure lived experience is not an add-on, but built into how decisions are shaped. And my closing thought is this position paper 2.0 is not just a document, it's really an invitation to implement. Again, I really would like to acknowledge and congratulate all involved in this amazing work on the different chapters. So I'm joining today's call to action. Let's use this roadmap, learn quickly, share what works, and hold ourselves accountable, always grounded in lived experience. And thank you.
Thank you, Claire. It's a really pleasure to work with a partner, a sponsor partner like MSD and you, because it goes beyond common expectations that civil society has about the role of industry. And MSD, I think, translates well the responsibility based on transparency and ethics of industry in relation to policies and how much you can bring to the table in this discussion. So I really appreciate that. Now I would love to invite everyone to share any questions that you may have about what you just heard today. We did receive 2 questions via the Q&A feature, which I replied. They were a little bit out of scope, so I'm not going to bring them in, but you can see the responses on the Q&A feature. You can put your questions on the chat or the Q&A feature. But just to keep the conversation going, I do have plenty of questions, and I do want to keep hearing from this amazing set of speakers who join us here today. And Hajar, I'd love to hear from you and learn how has taking part in the Morocco workshop and, of course, collaborating with the PCC Alliance has impacted NAB's work supporting patients in Morocco. I would love to hear from you if you could turn on your video and share with us.
Hello again. Well, we could say that we include some elements from the workshop, the personalized cancer care workshop, into our action plan. We organized campaigns dedicated to reducing stigma. And as I said earlier, it also creates an opportunity to foster collaboration among patients' organizations and strengthen networks. So many patients' organizations have been accepting our invitations and attending our events. And yeah, it fostered a sense of collaboration, if I can say. Thank you.
Thank you. And thank you for giving such practical examples, which I hope everyone can translate to their own work. There are a lot of learnings in this position paper 2.0 that you can apply to your own action plans, to your campaigns, and so on. Thank you so much, Hajar. Dr. Khaled, I would love now to ask you a question. And based on your rich experience at the regional level, where you've been collaborating with different countries and different organizations, which recommendations would you give to patient organizations on how to initiate meaningful collaborations and engagement with other patient organizations in their region? For those patient organizations who haven't been doing that, what would be your recommendations on how to start and establish meaningful relationships?
Okay, I thank you very much for this question. It is very important, actually, because Align is doing better than individual. When you are trying to advise another association, but I think it is very important that each association should be focusing not only on the patient. The journey of the patient is not starting in the patient, it is starting in the society. So I would like all the time to all the efforts gathering to one important goal is to involve with our society. In our societies, people actually liking and the volunteers' job, liking non-government organization to advise them, to lead them, to guide them for particularly awareness and early detection. On the other side, people is actually very conservative to listen to the government. And this is what is we are trying to use this favor or use this thing that we are acting more effort or acting more benefit for the society than the government. This is our role. This is our field. This is our media. Because of that, I advise those society to starting work in the society instead only. It's good to start with the patient. It's good to start with the other partner, but starting your effort to the society. By this step, we are helping people before having disease. Thank you very much.
Thank you, Dr. Khaled. It's always great to hear from practical advice, and I really appreciate this feedback. Now, can I invite Hiba again to the floor? And I would love to hear from you. What's the value for the WHO Eastern Mediterranean region in working with patient organizations and people with lived experience? I know you've mentioned you touched on this on your presentation, but maybe this time I would like to invite you to bring other examples, maybe in regards to the National Cancer Control Plans or other initiatives in the region that you've been engaging and working with patient organizations.
Right, Danny. So I think one of the greatest mandates of WHO is the WHO convening role, that we can play this role of connecting the puzzle together, because we have great efforts from the ministries and the government officials who are willing to fulfill their deliverables and commitments they have done to the public through the national strategies and national plans. However, we see this gap in implementation, and we see that they speak about holistic care, comprehensive care, patient-centered care, and these wonderful terms in many national cancer plans, for example, in the region. But when it comes to the implementation on the ground, there are, of course, lots of efforts are happening, but they need to be aligned with what people and what patients really wish to see. So having the voice of patients in these national cancer plans and strategies is the only way to make this happen, because countries are like running after themselves to do their best to improve their indicators and everything. But how can we make sure that this is really responding to the needs of patients if patients are not around the table? So WHO is basically working with the patient champions in countries, and also working to find more people, because we don't want this to be a tokenistic approach, or just like we are ticking the box, we are having a representative from patient community. We need this to be a sustainable engagement and a formalized one through policies and procedures. So we are working on that in 2 or 3 countries. However, the approach is quite different in these countries. Some countries prefer to establish multi-stakeholder ministerial committees that invite people with lived experience and their organizations, and they work from a policy level at first. And some countries would work more on access issues and community level issues first. So people are really empowered and they get the care that they need first, and then we can empower and we can scale up their participation at later stages. I can also mention something around simple development of communication material, how it really differed when we connected with patient organizations and people with lived experience. We have a bunch of material by WHO, and in the Eastern Mediterranean region recently we have worked on communication material that are titled Beyond the Diagnosis. So we are launching this campaign soon, and taking the opportunity to disseminate it among the audience of the call today. And it highlights what it takes to live with these conditions in this part of the world, rather than just providing early detection advices and management advices, which is critical, of course, but bringing in the human side and seeing this as a whole thing, the person, not just the disease, is very important to us as well.
Wow, very inspiring to learn about so many entry points of collaboration and opportunities. I'm happy to share with this group whatever you would like to share whenever it's ready. And so we can keep the conversation going, and those who want to engage more with the region are able to. We have 5 minutes left to go, and I did receive 2 other questions in the Q&A feature. And Hajar, work for you or potential collaborations for you? I'll connect you with one of IAPO's board members from Thailand. She just mentioned that it would be great to share Morocco's experience with breast cancer patients organizations in Thailand. So I'll make sure I'll make the connections. Thank you, Arjit. And someone, Jerome Babati, he put a question here, which I'll read out to you. From IAPO's global perspective, what are the most effective governance mechanisms that ensure patient organizations meaningfully influence national health policy, particularly in low and middle income countries where structural constraints remain significant? And I think this question, it's perfect for us to finalize or wrap up the discussions that we've been having here today, because it links directly with the work that IAPO has been doing to raise awareness and mobilize patient organization towards the agenda on social participation for health, because it's all about engaging people with lived experience, patients, communities, civil society as a whole, in health governance in their countries. Sam, Rachel from my team, if you could put a link for IAPO's webpage on this, and Jerome, we can continue the conversation after this, because there is an opportunity, there is a global commitment offering the possibility of governments around the world to implement social participation in their countries, and IAPO is mobilizing our patient community to be ready to hold these governments accountable for this political commitment. We launched a Global Patient Charter on social participation last year, which we hope it's going to be a strong advocacy to make this happen. So I am very excited and very grateful for the discussions we held here today. It's incredible that even though I have been engaged in this 3 years, directly engaged with the PCC Alliance and all of you in the last 3 years, it's incredible how much I still learn from other engagements with you. And today I also learned a lot from you. And I think that translates well how we have been working and collaborating, but also how we will continue this work from now on. Call to action, please do read this report, the Manila workshop report, but also the position paper 2.0. You see, they're very practical. They are presenting very interesting best practices that I'm sure can be either replicated and adapt to the specific context in your organizations and countries, but also inspire you to come up with similar or great initiatives to support the patients that you are working with. There are lots of great reflections that can be taken forward, and we'll continue to work on all of this I can see Dr. Khaled raise your hand. Would you like to share something? Okay.
I just want to have a comment on Dr. Hiba, which is very, very nice talk about the effort of WHO regarding this issue. I just want to ask her, because we have a lot of materials, particularly video, which is an awareness video for the cancer. Is it possible to have a communicate with Hiba and the WHO regarding this video to see if they can give us advice about this video, or at least can sharing this video with their effort? This is a comment and the question for Dr. Hiba.
Our pleasure, Dr. Khaled. You are a great friend of us, and I'll write to you right after this webinar, indeed. Thank you so much.
That's great. Thank you very much.
I love how connections are happening live here in this webinar, and this is, I think, a great example of the PCC Alliance and what can be done if we bring different voices, different perspectives to the room, and how much we can advance together. So a big thank you all. Today, a special thank you for the speakers who joined us today, but all the cancer patient organizations who worked with us throughout these 3 years, and more specifically in the position paper 2.0, and to all of you who made the time to be here. I'm living very inspired as usual every time I meet my PCC Alliance peers. Thank you so much, and
thank you.
Let's keep the conversation going.
Thank you very much. Thank you. Thank you very much. Bye. Thank you. Bye.
Bye.